Dr. Kaufman, I'd like you, if you could, talk a little bit more about some experiences working with those with cognitive impairments. You've already mentioned dementia, Alzheimer's.
So it's difficult, it really is. I mean, the first thing that you have to be as a house call dentist is extremely patient. I mean, things arise when you're working on this population of patients that would never happen in an office, such as they need to go to the toilet. So in the middle of everything, they have to get them up and to take them to the toilet. So you have to be extremely patient. You have to be extremely knowledgeable about their condition. In other words, you know, if they have, there's all different types of dementias and all different types of issues that they have. Some are very cooperative, some are not cooperative. So you have to have this unique ability to get them to cooperate, whatever it takes, whether they think that you're their friend or that you're related to them. I mean, if they say, "You're Susie, my sister," right? I'll say yes, because I want them to cooperate. So you go along with them. That's one of the things that you must do when you're dealing with dementia patients. And I put dementia and Alzheimer's all in one bucket, even though they're different and there's so many similarities. You just have to really know a lot about their actual personal issues before you even treat them. I like to find out if they're right-handed or left-handed because that's their dominant side. And I like to talk to them in that ear or from that side. You have to approach them always straight on. You never want to say, "Hey, the dentist is here," from behind. That scares them, that sets a tone immediately that might not make your visit very successful. So you have to look at them in the eyes. You have to be very quiet and soft-spoken. You have to say the things that they want to hear. And sometimes, you know, big fibs like you're their old dentist or you're their daughter's dentist or you're whatever it is. And you have to get them to understand that you're there to help them and whatever it takes for them to open. I mean, sometimes it's easy as all heck. And sometimes, you know, you have to fight them and it's going to take more time than it would normally take, which is one of the big issues that I have, you know, because I go from one house to the next. I like to ask on my new patient form, do you have a fear that the patient will not cooperate? And if they write yes, I know to book an extra half an hour so that I'm not so late for the next patient.